Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I'm here today with an amazing group of people, starting off, of course, with my co-host, Dr. Millicent Rovelo. How are you, Dr. Rovelo?
I'm doing excellent. And I'm even more excellent because we have two amazing guests with us today that we are very, very excited to have.
Hand-selected
Actually.
from a pool of over 12,000 applicants.
Yes.
No, actually, it was 35, but it's close.
Well, okay, let's not minimize that number because, okay, first of all, welcome to our 2025-2026 Aesthetic Fellows for the Aesthetic Surgery Fellowship.
So we have
Los
Dr.
Angeles.
Sam Malia, who is here from the University of Pittsburgh, a place near and dear to my heart,
Yes.
Yeah.
as it is my alma mater for
alma
residency.
mater, yep.
So welcome. And Dr. Vikram Mukherjee, who comes to us from Yale, a small little university somewhere in the Northeast.
You may have heard of it.
Maybe. I don't know. But it's great to have you both here.
Thanks for having
Thanks
us.
for having us.
Thanks for coming on. These are our new aesthetic surgery fellows for the year 2025-26.
But I wanted to, my point was, it was not out of a pool of 35. Like, by the time these kids, I'm sorry, you guys are not kids. By the time these young doctors get to this level, they have beat so many odds
I
to
know.
get to medical school. And then they got through a plastic surgery
I know.
residency, which is so competitive to get into. And then they clawed and fought and elbowed their way to the top of their class to get a plastic surgery aesthetic fellowship. So,
Yeah,
well done.
no one knows where the bodies are buried, but there are many on that journey. Many
Yes.
bodies are buried along that trail. But yes, it was very competitive. In plastic surgery, people don't know this, how few board-certified plastic surgeons there really are. And getting through the training, because there aren't that many spots.
There's not that many spots.
And then finding a fellowship like this. So you guys are the creme de la creme, and we're happy to have you.
We're so happy
Yeah.
to be here.
So tell us, why'd you come to Los Angeles? Let's start with you, Dr. Vik Mukherjee.
Oh, wait, actually, can we back up one question? Why aesthetic surgery? So you guys have both finished a full plastic surgery residency. You could go out in the world, hang a shingle, practice any brand of plastic surgery you want, but you chose to take an extra year to focus specifically on the aesthetic, cosmetic aspect of plastic surgery. Why?
I can start.
Go ahead.
I think that in residency, we're taught how to operate. We're taught how to move our hands gracefully, how to find tissue planes, how to avoid getting into trouble. But I think aesthetic surgery is extremely nuanced, and you have no excuse but to do it perfectly. It's elective surgery, and when the patient comes to you, they're kind of asking you, they're entrusting you with their body, which is pretty much the only thing that they really own in this world. And I think that you kind of have to give yourself the competitive edge, and you have to do a fellowship and train with the best to do that. So that's why I'm here.
I like that.
I mean, I would echo everything Sam said. I think it's just we learn how to do all these reconstructions and put people back together. But aesthetic surgery, it's unique because you really have to connect with the patient and figure out through communication what are their specific goals. And everyone has different goals, and it's subjective. And so for me, it's kind of the artistry of it and really figuring out with the patient, okay, how can I help you reach the goals that you have, your individual goals? And I just think it's really fun, going with them on that journey and kind of making it happen for them. So,
Well, translating their goals and your vision for their goals into surgery, I think is extremely difficult. And I think that's
totally.
what I've seen for the fellows who've trained with us, that they learn how to have control of the operations. Whereas I think in your residencies, you're learning to operate, you're learning to be a surgeon, you're learning how to do the surgery in, whatever
Safely.
safe manner that you can do it.
yeah.
But getting to this level where you're taking their wants, desires, and what's available for, kind of what they're bringing to the table is a really challenging job. It's not easy.
Yeah, I think most of aesthetic surgery happens before you even get to the operating room. So pretty much your pre-op evaluation. And then the second half of it actually happens after the surgery when you're seeing them in clinic and managing complications. So I at least didn't get a ton of that in residency. We operate into the ground, but we don't necessarily get a lot of clinic time. And I definitely wanted to have exposure to that before going out into the world.
Yeah,
For sure.
That's a big one. So then I guess to the question that you started with, why this fellowship?
Why'd you guys come here?
Why the aesthetic fellowship?
Well, I mean, for me, having basically grown up on the East Coast, medical school in Boston, Connecticut for training, you sort of see a certain side of how things are done. But as we know in plastic surgery, there's like 10 different ways to skin a cat.
Like 100.
Probably more.
You ask 100 plastic surgeons how to solve a problem, you will get 100 different answers. I promise you, no matter how simple the problem.
And if you ask each one of them, they will all say that theirs is right.
100%. Yes.
No, and that's
No egos.
And that's a great point, because then how do you sort through that, right? Because there are many different opinions, and they're pretty strong opinions, and everyone thinks they're right. And it's your job when you're figuring out how you want to do things is like, what's the best way that I'm going to do this? And so for me, I kind of knew just kind of inherently that exposing myself to something different, I was going to grow from it. And maybe there would be some similarities, but there'd probably be a lot of differences. And then you kind of put that together and you make the best of that for your own repertoire. So for me, it was kind of a no-brainer. Yeah.
What do you think, Sam?
Yeah,
Why come to the West Coast?
I honestly, again, would mirror everything that Vic said. I felt really, really privileged to train at Pitt. And I've done my entire life also on the East Coast, so I'm a through and through East Coaster. And I just felt like if I was going to take it a step further and kind of move up in the ranks from Pitt, I was going to have to kind of top that in a way. And for me, that's coming to this fellowship, which, I mean, I think anyone would agree that it's the best in the country. So I wasn't going to settle for anything less. And so I feel really fortunate to be here.
Well, it's great to have you both. I mean, we go through a rigorous process of how we select our fellows. And for those of you who follow the podcast, you know that we've had some pretty incredible people through, who came before you to do this fellowship, and they've been on the podcast discussing how they're doing, and they are all doing great. Their careers have, they've lit it up, which is great. And that's kind of the goal. What is it that you want to get? So in terms of, very specific, what did you see in terms of the operations, the way that we manage our practices? Obviously we have a lot of different surgeons that you guys get to work with. Mm-hmm. What operation did you really think was going to be like, I'm coming to LA because they do a lot of this? What would that be for you, Dr. Mukherjee?
So I would say the facial surgery and the nose surgery are very high level here. And part of that is because, of course, there's a lot of demand, but part of it is because there's a lot of revision surgery, and there's a lot of sort of fixing things that maybe didn't go right the first time. And that is kind of a unique challenge in of itself. So for me, that stood out as being a strong point of this fellowship.
Same for me. And I think actually when I was interviewing, I said that the reason I wanted to come here was because of the extensive face and nose surgery that you guys do. But I also want to give an honorable mention to body, which I've seen a lot of in the past month. And I think breast surgery can sneak up on you, and it's sneaky hard. And you guys also get a lot of body revisions. And I think that that's way more difficult to manage than people give it credit for. So that's another added benefit of being here. But initially for me, it was the face surgery, definitely.
Breast surgery, I think, is so hard. People will make it out to be like, oh, it's a slam dunk. We're going to put in some breast implants. Oh, we're just going to lift. I think breast surgery is extremely complicated.
Yeah.
If you want beautiful results.
Totally.
If you just want results,
Yeah, just want big breasts. Well, then, anybody can do that, right?
That's right.
But, if you want them to actually look good, it can be a challenge, because breasts are challenging, especially when they don't come to you with, the perfect, 25-year-old 32B anatomy.
Yeah.
How many of those are there? That's not who comes in for breast surgery. They come in because something ain't right.
Something's not right. One's looking up this way, one's looking down that way. I've had a few kids, lost some weight. I think breasts are really hard.
Yes.
But what you guys have said is not uncommon. Most of the fellows come for the face and the nose, because that's sort of what the fellowship is known for.
Yeah.
And then once they get here, they're like, whoa, there's actually a lot of breast and body, and it's kind of hard.
Yeah,
Yes.
it really, really is.
Yeah.
Agree.
It's all just depends on, you can drive a car or you can race in Formula One. Those are two different experiences completely. And surgery comes in all of those flavors in between. You can do plastic surgery. And you know what? Patients are going to be happy with plastic surgery because it's plastic surgery and they got something done and it's finished. But if you want that Formula One level, if you want that Ferrari level, then there's so much more. And I'm sure you both are at the beginning part of, I have a lot to do here.
Yeah.
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 And it's hard for people to understand that because they just see the Instagrams and the TikToks and what they see on TV. And they just say, oh, it's all the same. It's just, you just pick a plastic surgeon and go with it. And for the most part, that's going to work out.
More or less.
It is. It's going to work out. But if you're looking for that next level, you can't be blinded by the photoshopped Instagrams and the marketing campaigns that are so deceitful and bizarre to me that people do fall for them.
Yeah.
As we said in our last episode of the podcast, just because you're a billionaire doesn't mean you have to have bad plastic surgery, because the billionaires fall for it like nobody else. The billionaires can't find the best plastic surgeons. They have the hardest job of all. And we're right here, but it's very hard to see because if you can't get past the flash and the marketing and all the sheen that's put on the way that people present themselves as surgeons, it's very hard to find people who are actually good at this.
Yeah.
And being good at it is a whole different level, as you all know.
Totally.
Being good. I think probably coming through the fellowship, you guys will see various aspects of marketing, which obviously they don't teach in residency. Marketing and the business of plastic surgery, how to run an office, how to market it. And you will see all kinds of variations amongst the doctors and surgeons that you work with. And similar to how you choose your way of surgery, you'll probably find your way of marketing. I mean, I personally find that to be the hardest part of what I do. But hopefully, as you go along, you'll find a way that works for you that does not involve photoshopping and snake oil and whatever. Everyone has, I think people's social media more or less kind of reflects kind of who they are, who they want to project. So there's no right or wrong way of doing it. But it is something that you kind of have to learn how to do.
Totally.
It is. And I think in this fellowship, you learn more than just the surgery. You learn how to build a brand and how to market ethically and responsibly, but also how to stand out in a place where there's a lot of other surgeons. And you learn, the practice management and how to do all that. But that is not stuff you learn in residency because it's a very different model.
Or
working in a
medical
hospital.
school.
Yeah.
Yeah.
They don't
Yeah.
teach that and how to be a doctor.
Yeah.
Yeah.
No, that's like left off to well, go start your practice. I don't know how you learn that.
No, it's crazy.
Google.
Actually. Yeah.
I think you learn
How
by...
to open an S Corp. S Corp versus LLC.
Chat GPT, actually. Yeah.
Yeah.
Should be pretty helpful.
Maybe.
Yeah, ChatGPT works. The ethical thing is difficult because people don't really know the difference. So just for those of you watching, these two amazing surgeons are board-eligible plastic surgeons. They have completed their residency, in full. They don't need to do this fellowship. This is a voluntary, you chose to do this to be better. And you could hang a shingle and start operating and have privileges and be on your way to board certification in less than 16 months, basically. But instead, you've taken an additional 12 months and decided to be the best I can be, I'm going to do this additional training here. So we don't take that lightly, between, Dr. Gavami and Macias and Chopra and all the other people that are involved in the fellowship and Perez. And we don't look at that and just say, oh, whatever. We take it very seriously, and I'm sure you figured that out already.
It's clear.
We teach.
It's clear.
We mean business for you guys.
Yeah.
We want you to go out there and run the table when it comes to your practices, which we expect that you will, just based on who you are. But also, from our standpoint, our job is to get you ready for that, and it is a big deal because you're in our practices. So when people come and see patients, when the patients come to see us in our practices, you're there, and we present them to you, and we have everything from celebrities to the political people and everybody who comes in to get surgery, and our neighbors and our friends and other doctors who want surgery with us, and you guys are in the mix. We put you in. We don't hide you in the closet somewhere.
They're the bonus doctors.
Which happens. That's right. I know one of my amazing patients who's who's a big movie star, was like, it was when Stepien was here. He came in and like he got to know her and was taking care of her with me. And then one time I showed up and it was just me, and she's like, "Wait, where's my bonus doc? What, is he coming? Or where? I thought Dr. Stepien would be here." And I was like, "Oh, well, he's he's busy operating today. It's just me." And she's
Sorry.
like, "Oh, okay." So they get used to you, and they like having the fellows there, because they like when they learn that we're training people that are already just totally capable, they kind of go like, "Oh, this is so different. Like this is next level."
Mm-hmm. Yeah, I think that's actually one of the parts of the fellowship that's, at least so far, most meaningful to me, because medicine is such a slog, and we've done college and med school and 6 years of residency, and you kind of get lost in the shuffle sometimes. You feel like just a number, and it feels so personalized here. People really care about us as humans, and it's really nice. It's a nice change.
It's shocking, isn't it?
Unfortunately, it's a very new feeling. Yeah, it's like, wow, we're here doing what we want to do with people that we want to be around.
Yeah, and that we want to be like.
It's
so
different.
Cool.
Yeah, but I mean, it's great, and that's why we came.
Yeah, that's why we came.
Well, the key is to feel supported. That's the thing. You need to know that you have like the entire crew on your team, and we want to, we cheer for you. We want to see you win. And for people that are looking at you all, because people will see this podcast and they'll want to have surgery with you. They'll understand that your fellows clinic is available, and that we charge obviously a lot less for you all to do the surgery, because you're not us. I've been in practice for like a century, and so there's a little experience over here, and you pay for that. But at the same time, when they come to see you all, they get you all with us guiding them. And so when you're in my operations, obviously you assist me, you hold the retractors, you watch what I do, you do that. When I'm assisting you, you're doing the operation, but I'm guiding and coaching. And I think that that's really a big deal, because we've had a lot of people that come to the fellows clinic and get amazing operations.
Amazing.
And you guys could do it without us already. You don't need to have us there to guide you. But I can tell you, all the times that I had guidance from people that had been in practice for a long time, I learned something every time. Every time I went to observe somebody else, I learned so much. I mean, actually setting up a trip to go observe somebody now, because I want to see something that I was like, I don't really understand how they're doing that, and I want to go watch it. I don't have to do it. I just need to see how they do it and decide whether it's for me or not. And so that's a big deal. And you will get, you'll get patients from this podcast. There's no question. People will be like, "Oh, great, I can go to Beverly Hills and get the operation instead of, $175,000. I can pay, $25,000. I'm going, and that guy's going to be there. All right, we'll do it." And that's pretty much true across the board.
Yeah.
And I think, you've already done your own cases being here. Have you done some cases of your
Not
own
yet,
already?
but hopefully in the next month.
Yeah, it's coming, right?
Yeah.
And
Just did one today.
Yeah.
So,
Oh,
When
what'd
you showed
what'd
up,
you do today?
so Vic showed up and had one, I think the first week. He was like, "I want to show you this case." I was like, "Okay,
I think you said you're glad you're not doing
I was like, "I'm not doing that case. No way." But Vic was like, "Well, he wants me to do it. I'm diving in." So, and he did a great job.
Yeah.
Turned out great. So, yeah, there's plenty to do, right?
Yes.
And that's the thing. People will come.
It's busy. Yeah, I mean, did a case today and then saw a consult right before we headed over here, and so people are interested.
They are.
Yeah.
Because they're going to get they know they're going to get there's a level of quality control that's really important. We don't just throw you guys to the wolves and say good luck, which I know is kind of the case at a lot of resident clinics and other fellow clinics
Very
around the country, where they don't have the level of, like, our residents at USC get like incredible training. They get
Amazing.
huge guidance from us.
Yeah.
The attendings are there.
Yeah.
We're in the surgery. We want to be there. It's not an afterthought. Like, there's a real active training
And it's
attitude.
It's experts that do this routinely. It's not
Sure.
people that do a facelift every 6 months or something like that, and that makes a difference too.
Yeah.
No, I mean, we're all doing it.
And it's experts who are constantly operating long hours all day, every day, even on weekends, which I think there's like a misconception about the Beverly Hills plastic surgeon, maybe being on the golf course the second half of the day, but that is so far from true. I honestly, some days I feel like I'm still in residency because I am the first there and the last to leave, and it's long hours.
long days.
People
Plastic
are
surgery-
so committed. Yeah.
Plastic surgery is long. Yeah, we're not walking down Rodeo in the afternoons with our shopping bags.
Sam, I still feel like I'm in my residency.
I know. You work
I
like
do.
a resident.
I do work
That's
like a
the Pitt
resident.
plastic surgery way.
I can't get that out of my system, and I don't want to.
Yeah. No,
You know?
it feels good to work that hard, honestly.
I don't, I always want to be better. Like as I always say to my patients, I go, well, today's the day that I do my best operation ever.
Yeah.
And they're like, what do you mean? I go, well, this should be the best operation I've ever done. I have my most experience. I'm ready for your case. I've studied it. Why shouldn't this be the best rhinoplasty I've ever done? Why shouldn't this be the best facelift I've ever done?
Yeah.
It should be.
Yeah.
And that's how the attitude has to be, that I'm going to make it better 1% every day. And if you do that, then the results will show.
Yeah.
I've never come to the OR thinking like, this is routine.
Yeah.
Never, with a capital N.
Yeah.
And
I
maybe a
think-
capital R at the end too. Because I don't think you can do that. You have to come in and say, this is going to be better than it was yesterday.
I think that's especially the case in plastics too. I know like probably at the end of residency and the end of fellowship, people think like, I'm done. I can finally do my thing. But the learning never stops, especially in a field like plastics where every single person does things differently. And any case is valuable. Even in residency, we'd go to washouts as seniors because we knew that there was probably something to be learned from that type of case. And I think that's like something that I want to take forward with me because it's served me well so far. So.
Yeah, I think, yeah. So we always ask this question too of you guys because you're obviously brand new and welcome, and then we'll bring you back at the end of your fellowship, and sometimes the answers change, and you don't have to say anything specific, but where do you see yourself? As of today, what would be your goal for when you graduate? What would you like to see? Where do you want to practice? Any ideas? What kind of practice you'd have?
Should I start?
Sure.
Okay.
Yeah.
I am a big city girl. I was so fortunate, obviously, to be at UPMC for 6 years, but I think that I would like to end up either back in the New York area or stay here in LA. That's my dream. So one of those two, or maybe even bi-coastal, that would really be the dream. And I definitely want to join a practice where I can do head-to-toe aesthetics. And I also kind of have like a secret passion for Mohs recon of the face. So I think I would probably try and keep some of that up.
That's a twist.
Yeah.
We haven't heard that one yet.
Yeah, I just it's kind of like an homage to all the reconstructive training that I had for the past 6 years. And I think incorporates a lot of aesthetic surgery because in order to be a good aesthetic surgeon, I think you have to be a good reconstructive surgeon. So that's probably something I'd like to incorporate.
Interesting.
Our other resident, our other fellow from Pittsburgh liked toe surgery also, if you remember.
Toe surgery. She did like toe surgery.
No,
That's
it was
She was into
Xiao.
it.
Remember Xiao said, we do everything from head to toe.
Oh, yeah, sorry.
I was like, did you do everything
Head
from the toe?
to maybe just the metacarpals.
No, we talked the cankles were
Okay,
part of
fine.
it. Yeah,
Yeah,
so
all right.
we got down to the cankles.
Wow.
But I was like, did you do toe surgery this year? He's like, no, I did not actually. So maybe it's not from head to toe. But we did think that the cankles were very relevant.
Yeah,
Very
they
relevant.
truly are.
Dr. Mukherjee, what would you like to do?
So I'm similar to Sam in that I do enjoy living close to a big city. Doesn't have to be in a big city, but I'm loving LA, and I also love New York. So one of those locations or nearabouts. I think in terms of my practice, I think it's like a longer term goal, but it's really doing the surgeries and treating the patients that I want to be focusing on, not feeling like surgery is a job or like I'm having to do things to pay the bills, but really honing in on my specific interests and really becoming an expert in them. And I think that takes time, to build that practice. Probably when you start, you do a little bit of everything, but I would like to reach the point where I'm a specialist in something, and I'm really, kind of doing that week in and week out.
Do you have an idea what that specialty might be?
I really like facelifts and I really like noses. And so maybe this year I'll figure it out, but we'll see.
All right.
Yeah.
You're in the right spot.
Yeah.
I'm trying to figure it out.
Same.
I know. It's like, what am I
I'm
going to
still
do
in
when
that,
I
like,
grow
but I
up?
kind of like doing it all.
Yeah.
Yeah, I think I've kind of been pigeonholed now. I think I'm staying
Yeah,
in my
you're the
lane.
nose guy.
I'm nose, face, and I'll do very complex breast stuff. But I have done like 4 breast augmentations this year. They're just primary breast augmentations. 4.
That's not
That's a lot.
bad.
I know. There are guys that I know that they do 4 in a
A day.
I understand that. I understand. I got it. But mine are very special, and I treat them very differently.
Right.
So
They're very bespoke and
That's
boutique.
right.
Yes.
yeah, so I have, but especially these Motiva implants. That's kind of woken up my desire for primary breast augmentation.
Yeah.
Totally.
But it's all good. It's all fun. And I think for you guys, you have a big year ahead of you, and it will go by so fast you won't believe it. And it's just it's a blink, and then you're going to be in practice. So really every day have a plan. Know what you're doing and where you're going, and just get the most out of everything that you can, because it will be very soon that you will be shoved into the private practice world or academics even. I mean, we've had people go, Stepien went to Duke, he's the director of aesthetic surgery there.
Yeah.
And I think our last guest called it prividemics, which I thought was an interesting term.
Yeah. I like that one.
That's sort of what we are, because
we're
we have
prividemics.
are you blown away by how many like residents and visitors and
Yeah.
everything we
I
have
love
there?
it. I
Every
love
week.
it. Yeah.
Every week there's someone.
Were you like expecting that, or is it just like,
I mean,
holy
I
crow?
was one of them at one point, so it was on my
Exactly.
radar. But
Yeah.
I mean, I think you guys like to teach, and that's like a difference between a lot of people that are in practice and they just want to do their own thing and kind of
Go home.
yeah, and they just want to be left alone. But I really feel like you guys have a passion for teaching, and I think people feel that, and that's why they come here.
And that's why you started a fellowship.
Yeah, I mean,
Yeah.
well, we have a it was Grant Stevens that started this fellowship. Probably, I think it was 2001, wasn't it? When
I
he
don't
started?
know.
It was a while
It was a
back.
while back.
And then I asked him about it because I was going to start a fellowship as well in 2013 or something like that. And when I talked to him, he said, maybe we should do it together. He's like, maybe maybe I should expand the scope, because I don't really do noses. And it was just
Yeah.
so then when we started it with Edwin Kwan and Emily Hartman, they were our first fellows that did the combined, Marina Rocks Fellowship. Now it's obviously the Aesthetic Surgery Fellowship of Los Angeles. I think that's what it's called. It's very long. It's a lot.
I think we've shortened it. I think we dropped off the Los Angeles. We're now just the Aesthetic Surgery Fellowship.
I think we should just be
Mic
the
drop.
fellowship
Of all fellowships everywhere in all universes.
of Earth, of the universe. But I saw today on the Newsweek's top plastic surgeons that Edwin Kwan is on there for rhinoplasty.
No way. Oh, that's
Yeah,
wonderful.
I mean, and that's
great.
awesome that he's considered one of the top rhinoplasty surgeons in the country, and he's the guy that came to us from UCSF, and I trained him, and Grant, and he was with the two of us, and sure, I've always said this. I think his rhinoplasties are spectacular. He's really good, and you guys should get over with him too.
Yeah.
Yeah.
He
That would be
does.
awesome.
He's in K-Town. It's easy to get to, and he operates like a dog, man. He's busy as could be, and he's really good. So like the fact that our people go out and do well is very cool.
Yeah.
And this fellowship may even be expanding soon too, with some more faculty, which means we're going to need a third fellow.
Oh boy.
Yeah, we're
That's
thinking
so
about
exciting.
it. Yeah, it's we haven't announced it. It's not quite
Okay.
official, but it's getting there. So we'll test drive it a little bit with you guys this year. So
Yeah.
anything that you are hoping for, what's your your big hope for the year? But kind of before we wrap up, what are you hoping that this will be for you, Vic?
I think we've achieved like a certain level of competence, and like you said, we're fully trained to do all of the procedures. But when you go in for a procedure, you want to know that you're about to nail this thing. And I think, and that takes experience, like you said. And we've trained for 6 years, but this is 1 year where we're doing this day in and day out. And my goal by the end of the end of the year is to have that confidence, because I've done it so many times, to know like I'm gonna nail this, and to not really have that, questions or concerns per se. So that'd be my goal, is to be able to kind of deliver those top tier results consistently every time.
Dr. Malia.
I think I have quite a few learning goals for the year. I want to learn everything, obviously, but I really want to focus on clinic time. I think that's really important to me. I think Vic probably feels similarly about Yale, but Pitt taught me how to operate, I guess, for the most part. And I really want to be able to see patients preoperatively, give them a diagnosis, come up with their proper surgical plan. I want to be able to manage their complications post-op, because I think that's something that, we don't get a lot of exposure to. And then in this month alone, I've seen more aesthetics than I have in my entire life. So I want to be a sponge and soak in as many of these advanced techniques as I can. And so I just want to feel that much more comfortable when I finally go out into the world as my own person. So that's my goal.
Great. I like it.
I think those are my goals too.
Yeah, right? Same. Still
I just want to get better. I know, always. I mean, you've probably seen it how I go into these cases. Like, I'm not going in like I got this ever. I always go into it with a like, all right, how can this be next level?
Yeah.
How can it be even better than we thought it could be?
Yeah.
And I think that's really the key. You have to have that drive, and that's something that you can be taught.
Yeah.
It isn't instilled in you in your residency necessarily.
No.
I mean, Pitt kind of does that a little bit. There's a little bit of that, like, how are we going to do this better? I don't know how it was at Yale, but like Pitt, like there was always that, like the Michael White time that you spend.
Totally.
Like there were times where they're just like, you're just not good enough.
Yeah.
Like, so how are you going to be better?
Yeah, every M&M was an opportunity to kind of come together as a department and just question one another in a very amicable way, because Pitt is known for being like a family. We all love each other, but we definitely pushed each other, attendings included. They would question each other all the time in a public arena, and it made everyone better, I think.
Yeah, I mean, resting on your laurels is the beginning of the end. Like, there's no resting.
Totally.
Yeah, and we have no laurels,
Yeah.
so I don't even know what a laurel is. So we don't even have those to rest upon. So you will not rest on your laurels. But at the same time, you'll grow, you'll get better.
Yeah.
And, again, I'll love to watch your cases that you all do, with your patients. And all of us are aggressive about getting the fellow cases to you all and making sure that you get the most that you can out of them for your patients. Our goal is to make sure that they get a great result and get a great experience. Mm-hmm. And that's another thing that you probably have seen too, is like the plastic surgery experience in LA is a little different than where y'all came from.
Yeah.
Yes.
Yeah.
It's a little different.
It's very nice for the patients.
Yeah.
It's an upgrade for sure.
I mean, Jenny was on the phone today with the Peninsula, like putting together our whole new aftercare
goodness.
package.
Yeah.
That like is like a 10 days, like it's crazy what she's doing. And she's just like, this is what I'm going to do. I'm tired of these aftercare people. This is how we're going to do it from now on. And I was like, that sounds really good. I want to do that.
I want to do that.
Yeah.
I know, right? You
Send me to-
will
I
do
will be
that.
doing that. I already love the Peninsula, and I know I'm having plastic surgery soon. So, yeah. I tell her to, move that
Yeah, there you go. Well, you guys, anything else that you want to say to the folks out there, say to us, tell us, anything else on your mind before we wrap it up?
I think all I would say is it's been an amazing first month so far. I think it's everything I expected it was going to be and more. And I'm just really excited for the year. I'm learning a lot already.
Yeah. I pinch myself every day that I'm here, and I will take advantage of each day, and I'll make you guys proud.
That sounds really good.
Well, before we go, for the listeners, if they are so inclined to get a surgery with our wonderful fellows, how would they do that? What is that process?
Well, they can go through the website, which is one way to do it.
Which is what?
I think it's LA Plastic Surgery, LAaestheticsurgery.com.
Yeah.
Yeah, it's LA and then the words written out, aestheticsurgery.com is the website. But certainly you can go through our Instagram. You guys have an Instagram, right?
Yep.
We do.
It's The Aesthetic Fellowship
Yep.
That's correct.
on Instagram. And then you can also call any of our offices and say, I want to see the fellow.
Which is also
certainly.
sort of the most direct.
Yeah, I mean, so like a lot of the cases come because they call, like they want to come and see me for a rhinoplasty or facelift. And then my assistant Caroline, who's amazing, will talk to the people and say, well, that the budget is this, and they'll go, oh, that's a lot, that's out of my range or whatever. And they say, well, don't
sweat it.
don't give up yet. Let me get you to our fellows. And so then they see these amazing fellows and say, like, you know what, if Dr. Calvert's, the quality control, then I'm coming. And they do, and they come, they get great surgery. And we've had a lot of really good experiences with that. And I think the patients are very happy to get that type of an experience where they still, I mean, you guys could do, like I said, you can do it on your own now. You don't need us. And you do a great job. The idea is to do an even better job, the best job that you possibly can, and really max it out. So I think those are the best ways. The Instagram, the website, call our offices, whatever. We know who the fellows are. We'll get you
We'll
in
get you
front
there.
of them. And I mean, I think that's the key is, just be open to the fact that you can get great surgery without having to spend the Beverly Hills dollars. If you want to come to me, you're going to have to spend the Beverly Hills dollars. And my schedule is, I started realizing this is something very interesting. So I'll probably retire from Beverly Hills and do something very different in the next 6 to 8 years, right? And so I started doing the numbers of operations that I have left, in that arena. It's not a lot because I only do about 200 operations a year, maybe 220, something like that. So then you start going like, I probably have about 1,000 operations left to do.
Sure.
Oh my
Yeah.
goodness.
So like it's like they're running out.
Yeah.
Should we start a countdown?
I may do that, because I mean it's like, I'm not going to do this forever. I have some interest in facial transplant and in composite tissue transplant. I have some things I want to do that are going to require me to be at a university, and maybe I'll still do these things as, but I don't want to be the guy that stayed a little too long at the circus. You know what I mean?
Yeah.
Like it's
Yeah. We've all seen that, and it's not pretty. It's
Not pretty.
it's not cute.
Raj Kanodia, who I love very much, told a story about his mentor, who will remain nameless. And he said on his last operation, he said, well, how did I do? He goes, it's a good thing this was the last one.
Oh, no.
I don't want to be that guy. I don't. And I'm nowhere near there, that's for sure. I mean, there are people that are, 7 and 8 years beyond what I'm talking about that are still operating and doing great work. But I also, I have some other interests. So it's like, doing this Beverly Hills thing is great. I love it. I'm in the zone, and that's where you want to be. And I think when it starts to become onerous, then you shouldn't be there, And I'm not sure when I'm 65 or 66 years old that it won't become onerous. Maybe it won't. Maybe I'll be going like gangbusters. I will tell you that Terry Dubrow told me that he loves what he does now. And he's in that age bracket. He's probably about 8 or 9 years older than me. And he said, Jay, he goes, I know the most that I know. I have the skills that I've been, wanting to have my entire career. Why would I stop? He goes, I don't need money. He doesn't. That's not why he does it. He does it because he loves surgery and he's really good at it. And so he says, my hands are working. My eyes are great. I'm going to keep going. And I may feel that way too. And he told me for sure that I'll eat these words that I've said. So, and I trust him because he's a very smart guy. So the good news for you guys, you have all the choices in front of you. All of your career is ready to just blow wide open. And we congratulate you on being here. And thanks for doing this podcast.
Thanks
Thank
for
you.
having us.
Thanks for having us.
And in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.